Hi, I'm Ravi. I'm one of the children's doctors at the Countess of Chester. We're seeing a lot of little ones with really bad chests at the moment, even though it's summer. And we knew this was going to happen because when children started mixing with each other again, all the viruses that have been laying low for the last 16 months were going to be back with a vengeance. And we're seeing a lot of little ones with a condition called bronchiolitis. Bronchiolitis happens when the viruses that normally cause colds get down into the smaller lung tubes. It's an illness that doesn't need any specific treatment. It gets worse for 2 or 3 days, bottoms out for 2 or 3 days, and then gradually gets better, although you can cough for a few weeks. And most children won't need to come to hospital. But some children might need to have a look at. So most of the time, if your little one is managing to drink around half of what they'd normally have, and they're still having wet nappies, their temperature is below 38.5, and they're looking nice and pink, even if they're coughing and struggling a bit with their breathing, you can probably manage them at home. If they're having fewer and fewer wet nappies, if they're not managing to feed, or they're feeding and it's making their breathing worse and they're coughing and bringing everything up with it, then we may need to have a look at them. And certainly if they're looking a bit pale and they're a bit more lethargic, we may need to take a look at them. And if they've got a higher temperature above 38.5 too. And sometimes bronchiolitis can make little ones very ill, and certainly if they're drowsy, they've got cold hands and feet, or they're having an irregular breathing pattern, then we certainly need to look at them. Most of the time, you can manage them at home with a bit of Calpol and small amounts of fluid frequently. If you're worried, have a look at the charts, and if there's concerns, seek medical advice. You can call 111, call your GP. If you're really worried, then certainly A&E is there, but I'd certainly sort of try and manage it at home first. Thanks.